Question 1. Assessment of a companion animal's behavioral concern requires a professional to consider multiple perspectives. When presented with a dog exhibiting what the owner describes as stubbornness and disobedience during training sessions, which approach best reflects the principles of companion animal services and prioritizes the animal's welfare? Option A. Conducting a detailed behavioral history, observing the dog's interactions and responses in its environment, and consulting with a veterinarian to rule out medical causes before developing a humane behavior modification plan. Option B. Relying solely on the owner's interpretation of the behavior and advising them to ignore the dog until it complies with commands. Option C. Suggesting that the owner rehome the dog due to the perceived difficulty in managing its behavior without further investigation. Option D. Immediately implementing a strict, punishment-based training regime, as described by the owner to assert dominance and correct the perceived disobedience. The correct answer is A. Conducting a detailed behavioral history, observing the dog's interactions and responses in its environment, and consulting with a veterinarian to rule out medical causes before developing a humane behavior modification plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the owner's perception of their pet's behavior with objective behavioral principles and the animal's welfare. Owners often anthropomorphize their pets, leading to misinterpretations of behavior that may be normal for the species but are perceived as problematic. The challenge lies in providing accurate, evidence-based advice that respects the owner's bond with their animal while prioritizing the animal's well-being and safety, adhering to the principles of responsible companion animal care. Correct approach analysis. The correct approach involves a thorough assessment of the dog's behavior in its natural environment, considering all contributing factors such as breed predispositions, environmental influences, socialization history, and potential underlying health issues. This aligns with the principles of the Certificate Roman III in Companion Animal Services, which emphasizes understanding animal behavior to promote welfare and responsible ownership. By focusing on observation, data collection, and applying established behavioral principles, the professional can provide accurate diagnoses and effective, humane management strategies. This approach is ethically sound and legally defensible, as it prioritizes the animal's welfare and aims to prevent suffering or harm, which are core tenets of animal care regulations. Incorrect approach is analysis. An approach that solely relies on the owner's subjective description without independent observation or consideration of other factors is professionally flawed. This can lead to misdiagnosis and inappropriate recommendations, potentially exacerbating the behavior or causing distress to the animal. It fails to uphold the professional duty of care to the animal. Another incorrect approach would be to immediately recommend punitive or aversive training methods based on limited information. This contravenes modern, ethical animal behavior principles and the spirit of regulations promoting humane treatment. Such methods can suppress behavior without addressing the underlying cause, leading to increased anxiety, fear, or aggression, and can constitute animal cruelty under relevant legislation. Finally, dismissing the owner's concerns outright without a proper assessment is unprofessional and counterproductive. While the owner's interpretation may be inaccurate, their perception of a problem warrants investigation. Ignoring their concerns erodes trust and prevents effective intervention, potentially leading to the animal being surrendered or euthanized due to unaddressed behavioral issues. Professional reasoning. Professionals should adopt a systematic, evidence-based approach. This involves 1. Active listening to the owner's concerns. 2. Conducting a comprehensive behavioral history and observation. 3. Applying knowledge of ethology and learning theory. 4. Considering differential diagnoses, including medical causes. 5. Developing a behavior modification plan that is humane, effective, and tailored to the individual animal and owner. 6. Adhering to relevant animal welfare legislation and ethical guidelines. Question 2. When evaluating the most appropriate grooming techniques for a variety of companion animals, which approach best demonstrates adherence to Australian animal welfare standards and professional best practice for a Certificate Roman III in Companion Animal Services graduate? Option A. Employing species-specific grooming tools and handling methods, adapting techniques based on the animal's coat type, temperament, and individual needs to ensure safety and minimize stress. Option B. Utilizing a standardized set of grooming tools and techniques across all species, prioritizing speed and efficiency to maximize client throughput. Option C, forcing animals into grooming positions that cause them significant anxiety or fear, assuming this is necessary to achieve a clean groom. Option D, using aggressive dematting tools and techniques on all animals with matted fur, regardless of species, to quickly remove tangles. Correct answer is A, employing species-specific grooming tools and handling methods, adapting techniques based on the animal's coat type, temperament, and individual needs to ensure safety and minimize stress. Explanation: this scenario is professionally challenging because it requires the groomer to adapt their techniques based on the specific needs and temperaments of different species, while also adhering to Australian animal welfare legislation and industry best practices. A one-size-fits-all approach to grooming is not only ineffective, but can also lead to stress, injury, and poor outcomes for the animals. Careful judgment is required to select the most appropriate tools, methods, and handling techniques for each individual animal and species. The correct approach represents best professional practice because it prioritizes the animal's welfare, safety, and comfort. This aligns with the principles of the Prevention of Cruelty to Animals Act 1979, NSW, and similar legislation in other Australian states, which mandate that animals must be treated humanely and not subjected to unnecessary pain or distress. Employing species-specific grooming techniques, such as using a slicker brush for a double-coated dog versus a comb for a long-haired cat, and understanding the nuances of handling each species, demonstrates a commitment to professional competence and ethical responsibility. This approach minimizes the risk of injury, reduces stress for the animal, and leads to a more effective and positive grooming experience. An incorrect approach that involves using the same aggressive dematting tool on a cat's delicate skin as one might use on a dog's thicker coat would be a significant regulatory and ethical failure. This could lead to skin abrasions, cuts, and extreme discomfort for the cat, violating the duty of care owed to the animal under animal welfare laws. Similarly, forcing a dog into a position that causes it significant anxiety or fear, without attempting to use calming techniques or species-appropriate restraint, would be ethically unacceptable and could be construed as causing unnecessary distress. Another incorrect approach might be to neglect the specific grooming needs of a particular breed, such as failing to properly condition a poodle's coat, leading to severe matting and potential skin issues, which again breaches the duty of care. Professionals should employ a decision-making framework that begins with a thorough assessment of the individual animal, considering its species, breed, coat condition, temperament, and any known health issues. This assessment should then inform the selection of appropriate grooming tools, techniques, and handling methods. If an animal exhibits signs of stress or fear, the groomer should immediately reassess their approach, employing calming strategies, taking breaks, or, if necessary, ceasing the grooming session and consulting with the owner or a veterinarian. Continuous learning and staying updated on species-specific grooming best practices are crucial for maintaining professional standards and ensuring animal welfare. Question 3. The evaluation methodology shows that when assessing a new brand of companion animal food for a client, a professional should prioritize understanding the detailed ingredient list and guaranteed analysis over superficial marketing claims. Which of the following actions best reflects this methodology in the Australian regulatory context? Option A. Relying solely on the brand's reputation and online reviews to determine the quality and appropriateness of the pet food. Option B. Prioritizing the identification of the main protein sources and their order in the ingredient list, and comparing the guaranteed minimum protein and fat percentages against the animal's dietary requirements. Option C. Assuming that any food listing a specific vitamin or mineral will meet the animal's needs without checking the guaranteed analysis for actual quantities. Option D. Focusing on prominent front-of-pack statements such as premium quality or veterinarian recommended to gauge the overall suitability of the food. The correct answer is B. Prioritizing the identification of the main protein sources and their order in the ingredient list, and comparing the guaranteed minimum protein and fat percentages against the animal's dietary requirements. Explanation: scenario analysis. This scenario is professionally challenging because accurately interpreting pet food labels is crucial for animal health and owner satisfaction. Misinterpreting ingredients or nutritional information can lead to inappropriate dietary recommendations, potentially causing health issues for the animal and damaging the professional's reputation. The professional must navigate a complex landscape of ingredient lists, guaranteed analyses, and marketing claims, all while adhering to Australian regulations for pet food labeling. Correct approach analysis. The correct approach involves a systematic review of the entire ingredient list, paying close attention to the order of ingredients, which indicates relative quantity by weight, and identifying the primary protein sources. It also requires understanding the guaranteed analysis to assess key nutrient levels like protein, fat, and fiber. This aligns with the Australian Competition and Consumer Commission (ACC) guidelines and the Australian Standard for the Labeling of Pet Food as 5812/2017, which mandate clear and accurate ingredient disclosure and nutritional information to prevent misleading consumers. This approach ensures the professional can provide informed advice based on factual product composition. Incorrect approach is analysis. One incorrect approach is to solely focus on the front-of-pack marketing claims, such as grain-free or natural. This is a regulatory failure because it bypasses the detailed ingredient information required by law, which is designed to prevent misleading consumers. Such claims can be subjective and may not reflect the overall nutritional adequacy or suitability of the food for a specific animal. Another incorrect approach is to assume all ingredients listed are equally beneficial or digestible without considering their source or processing. This is an ethical failure as it could lead to recommending a product that, despite appearing to meet basic criteria, contains ingredients that are poorly absorbed or could cause sensitivities in certain animals. Australian regulations aim for transparency, and a superficial understanding undermines this. A third incorrect approach is to disregard the guaranteed analysis and focus only on the ingredient list. The guaranteed analysis provides essential quantitative data on nutrient content, which is vital for assessing the food's suitability for an animal's life stage, activity level, and any specific health conditions. Failing to consider this data is a failure to provide comprehensive and accurate advice, potentially contravening the spirit of consumer protection laws that aim for informed purchasing decisions. Professional reasoning. Professionals should adopt a structured approach to pet food label analysis. This involves 1. Reading the entire ingredient list from first to last, noting the primary ingredients. 2. Examining the guaranteed analysis for key nutrient percentages. 3. Cross-referencing ingredient information with the guaranteed analysis to ensure consistency. 4. Considering the animal's specific needs, age, breed, health status, activity level. 5. Consulting relevant Australian standards and guidelines for pet food labeling to ensure compliance and best practice. 6. Prioritizing factual information over marketing claims. Question 4. Market research demonstrates that owners of companion animals often seek advice from animal care professionals regarding their pet's well-being. A client brings their dog, a typically energetic Labrador, to a grooming salon. The owner notes that the dog has been unusually lethargic for the past 24 hours, has a reduced appetite, and has vomited once this morning. The dog appears otherwise clean and well-groomed, with no obvious external injuries. Based on your understanding of basic canine anatomy and physiology, what is the most appropriate course of action? Option A. Suggest that the dog may have eaten something it shouldn't have and recommend giving it some plain boiled chicken and rice to see if its appetite improves. Option B. Advise the owner that these symptoms warrant immediate veterinary attention and explain that while you can observe the dog's general condition, you cannot diagnose or treat medical issues. Option C. Offer to administer a mild over-the-counter anti-nausea medication that you have on hand to help settle the dog's stomach. Option D. Reassure the owner that lethargy and reduced appetite are common in dogs and that the dog will likely recover on its own with rest. The correct answer is B. Advise the owner that these symptoms warrant immediate veterinary attention and explain that while you can observe the dog's general condition, you cannot diagnose or treat medical issues. Explanation. This scenario is professionally challenging because it requires the application of basic anatomical and physiological knowledge to a practical situation involving animal welfare and client communication. The challenge lies in accurately identifying potential issues based on observable signs, and then communicating this information effectively and ethically to a pet owner, while adhering to the scope of practice for a Certificate Roman III in companion animal services. Careful judgment is required to distinguish between normal variations and potential health concerns that warrant further professional veterinary attention. Correct approach represents best professional practice because it prioritizes the animal's welfare by recognizing signs that suggest a deviation from normal physiology and recommending appropriate action. This aligns with the ethical responsibility of animal care professionals to act in the best interests of the animal and to seek qualified veterinary advice when necessary. It also demonstrates an understanding of the limitations of the Certificate Roman III qualification, which does not permit diagnosis or treatment of medical conditions. An incorrect approach that involves attempting to diagnose the condition or provide specific treatment advice would be a significant regulatory and ethical failure. This would exceed the scope of practice for a Certificate Roman III qualification, potentially leading to harm to the animal if the advice is incorrect or delays proper veterinary care. It would also breach professional conduct guidelines by undertaking tasks for which one is not qualified. Another incorrect approach, such as dismissing the owner's concerns without adequate consideration or observation, would be an ethical failure in client communication and animal welfare, potentially leading to a misdiagnosis and negative outcomes for the animal. Professionals should use a decision-making framework that begins with careful observation of the animal's behavior and physical presentation. This should be followed by comparing these observations against their knowledge of normal anatomy and physiology for the species. If any signs suggest a deviation from normal, the next step is to consider the potential implications for the animal's health and well-being. Crucially, the professional must then determine if the situation falls within their scope of practice. If it involves potential illness, injury, or a significant deviation from normal, the professional decision-making process must lead to recommending consultation with a veterinarian. Effective and empathetic communication with the owner is paramount throughout this process. Question 5. Upon reviewing a dog's behavior during a grooming session, you notice it repeatedly licking its lips, yawning, and subtly shifting its weight away from your touch. The dog is not growling or showing overt aggression, but its body language suggests it is becoming increasingly uncomfortable. What is the most appropriate immediate course of action to ensure the dog's welfare and maintain a positive experience? Option A. Pause the grooming session. Offer a brief positive reinforcement, e.g., a small treat or calm praise, and then gently reassess the dog's comfort level before continuing with a modified approach. Option B. Continue with the grooming session as planned, assuming the dog is just being a bit restless and will eventually settle down once it gets used to the process. Option C. Stop the grooming session immediately and return the dog to its owner without explanation, as it is clearly too stressed to be handled. Option D. Firmly restrain the dog to complete the grooming quickly, as delaying the process will only prolong its discomfort and make it more anxious. The correct answer is A. Pause the grooming session. Offer a brief positive reinforcement, e.g., a small treat or calm praise, and then gently reassess the dog's comfort level before continuing with a modified approach. Explanation. This scenario is professionally challenging because it requires the handler to interpret subtle, nonverbal cues from an animal that could indicate distress or discomfort, and to act appropriately to ensure the animal's welfare. Misinterpreting these signals can lead to stress for the animal, potential injury, or a breakdown in the human-animal bond, all of which are contrary to the principles of responsible companion animal care. The correct approach represents best professional practice because it prioritizes the animal's well-being and safety by recognizing and responding to its communication. This aligns with the ethical obligations of anyone working with companion animals, which include understanding and respecting their needs and behaviors. Specifically in Australia, the Prevention of Cruelty to Animals Act 1979, NSW, and similar legislation in other states, along with industry codes of practice, mandate that animals must be provided with adequate care and protection from suffering. This includes understanding and responding to signs of distress. An incorrect approach that involves ignoring or dismissing the animal's body language is a failure to provide adequate care and protection, potentially constituting a breach of animal welfare legislation. For example, continuing with a training exercise when an animal is showing clear signs of fear or anxiety, e.g., lip licking, yawning, tucked tail, avoidance, could be interpreted as causing unnecessary suffering. Similarly, assuming the animal is simply being difficult or disobedient without considering its communication is a failure to apply professional judgment and knowledge of animal behavior, which is a core competency for Certificate Roman III in companion animal services. This demonstrates a lack of understanding of animal welfare principles and could lead to negative outcomes for the animal and reputational damage for the professional. Professionals should employ a decision-making framework that begins with careful observation of the animal's behavior. This involves actively looking for subtle cues that indicate the animal's emotional state. If concerning signals are observed, the next step is to interpret these signals in context, considering the environment and the activity taking place. The professional must then decide on an appropriate course of action that prioritizes the animal's welfare, which may involve pausing the activity, modifying the approach, or seeking further advice. This process is iterative and requires ongoing assessment of the animal's response. Question 6. During the evaluation of a new client's companion animal, the professional observes a small, furry mammal with long ears, twitching nose, and hind legs adapted for hopping. The owner describes the animal as a bit skittish and mentions it enjoys chewing on cardboard. The professional has extensive experience with dogs but limited direct experience with other common companion species. What is the most appropriate initial course of action to ensure the animal's welfare and provide accurate advice? Option A. Attempt to identify the species based on the observed characteristics and owner's description, then consult reliable resources or seek expert advice regarding rabbit care before providing any specific advice or care. Option B. Assume the animal is a small dog breed, given its furry nature, and provide general dog care advice, focusing on diet and exercise. Option C. Provide generic advice applicable to most small mammals, such as ensuring a clean environment and access to water, without attempting specific species identification. Option D. Advise the owner that without proper identification, no specific care can be recommended, and suggest they return when the species is definitively known. The correct answer is A. Attempt to identify the species based on the observed characteristics and owner's description, then consult reliable resources or seek expert advice regarding rabbit care before providing any specific advice or care. Explanation. Scenario analysis. This scenario presents a common challenge for individuals working with companion animals, encountering a species with which they have limited direct experience. Professionals must rely on their foundational knowledge of animal behavior, welfare needs, and relevant Australian regulations to provide appropriate care and advice. The challenge lies in accurately identifying the animal's species and then applying the correct welfare standards, which can vary significantly between different types of companion animals. Misidentification or a lack of understanding of specific species needs can lead to suboptimal care, stress for the animal, and potential breaches of animal welfare legislation. Correct approach analysis. The correct approach demonstrates a commitment to accurate identification and species-specific care, aligning with the principles of responsible animal husbandry and the requirements of Australian animal welfare legislation, such as the Prevention of Cruelty to Animals Act (POCTA) in relevant states or equivalent legislation. By seeking expert advice and consulting reliable resources, the professional ensures they are providing care that meets the unique biological and behavioral needs of the rabbit, thereby upholding their duty of care and adhering to regulatory standards for animal welfare. This proactive and informed approach minimizes the risk of harm and promotes the well-being of the animal. Incorrect approaches analysis. One incorrect approach involves assuming the animal is a dog based on its general mammalian characteristics. This is a regulatory and ethical failure because it ignores the distinct welfare requirements of rabbits, which differ significantly from those of dogs. Rabbits have specific dietary needs, housing requirements, social behaviors, and susceptibility to certain health issues that are not met by dog-specific care. This misapplication of knowledge could lead to inappropriate feeding, inadequate housing, and stress for the rabbit, potentially breaching animal welfare laws. Another incorrect approach is to provide generic advice without confirming the species. This is a failure to exercise due diligence and a potential breach of professional standards. While some general principles of animal care apply across species, specific needs related to diet, environment, and handling are critical. Failing to identify the species means the advice given may be entirely unsuitable, leading to poor welfare outcomes and a disregard for the specific legal obligations associated with caring for different companion animal species in Australia. A further incorrect approach is to dismiss the owner's concern and proceed with care based on a superficial assessment. This demonstrates a lack of empathy, poor communication skills, and a failure to recognize the importance of owner input. Ethically, it undermines the professional-client relationship. Legally, it could be seen as negligence if the animal subsequently suffers due to the lack of appropriate care, as the professional has failed to adequately investigate the situation and address the owner's concerns, which may have stemmed from a genuine observation of the animal's needs. Professional reasoning. Professionals should adopt a systematic approach when faced with unfamiliar animals. This involves 1. Active listening to the owner's concerns and observations. 2. Careful visual assessment of the animal, noting key physical characteristics. 3. Utilizing available resources, including identification guides, veterinary professionals, or experienced animal handlers, to confirm the species. 4. Researching and understanding the specific welfare needs, legal requirements, and common health issues associated with the identified species. 5. Communicating clearly and empathetically with the owner, providing tailored advice based on accurate information and best practice. This process ensures that care is appropriate, ethical, and legally compliant. Question 7. The risk matrix shows a moderate risk associated with providing dietary advice for a diverse range of companion animals. A new client has brought in a rabbit and a parrot and is seeking advice on appropriate feeding practices beyond their current commercial diets. They are concerned about ensuring optimal health for both pets. Which of the following approaches best addresses the nutritional requirements for these different species within the Australian regulatory framework for companion animal services? Option A. Advise the client to continue with high-quality commercial rabbit pellets and a standard parrot seed mix, as these are generally formulated to meet the basic needs of most pets. Option B. Recommend a general-purpose all-in-one pet food that is widely available and marketed as suitable for a variety of small animals. Option C. Research the specific dietary needs of rabbits and parrots, focusing on their unique digestive systems, essential nutrients, and common dietary deficiencies or excesses, and then provide tailored recommendations based on this evidence. Option D. Suggest a balanced diet of fruits and vegetables for both the rabbit and the parrot, as variety is generally beneficial for all animals. The correct answer is C. Research the specific dietary needs of rabbits and parrots, focusing on their unique digestive systems, essential nutrients, and common dietary deficiencies or excesses, and then provide tailored recommendations based on this evidence. Explanation. This scenario is professionally challenging because it requires the application of specific knowledge regarding the nutritional needs of different companion animal species, which can vary significantly. Misinterpreting these needs can lead to serious health consequences for the animals, impacting their welfare and potentially leading to legal repercussions for the service provider. The challenge lies in moving beyond general assumptions about pet food and understanding the nuanced dietary requirements dictated by species, life stage, and health status, all within the Australian regulatory framework for animal care and services. The correct approach represents best professional practice because it prioritizes the individual animal's welfare and adheres to the principles of responsible pet care as outlined in relevant Australian legislation and industry guidelines. This involves consulting reliable, evidence-based resources and tailoring dietary recommendations to the specific species and their unique physiological requirements. This proactive and informed approach minimizes the risk of nutritional deficiencies or excesses, promoting optimal health and well-being, and aligns with the duty of care expected of individuals working in companion animal services. An incorrect approach that relies solely on readily available commercial pet food without considering species-specific needs fails to meet the duty of care. This could contravene the Prevention of Cruelty to Animals Act or equivalent state legislation by failing to provide adequate and appropriate nutrition, leading to suffering. Another incorrect approach that involves recommending a one-size-fits-all diet for all animals, regardless of species, demonstrates a lack of understanding of fundamental animal physiology and nutrition, which is a failure in professional competence and could lead to adverse health outcomes. Again, potentially breaching animal welfare legislation. Recommending a diet based on anecdotal evidence or personal preference rather than scientific understanding is also a significant ethical and professional failing, as it prioritizes subjective opinion over objective animal welfare needs and established best practices. Professionals should adopt a decision-making framework that begins with identifying the specific species and their known nutritional requirements. This should be followed by consulting reputable sources such as veterinary nutritional guidelines, peer-reviewed scientific literature, and established animal welfare codes of practice. When providing advice or care, the individual animal's life stage, health status, and any specific dietary sensitivities or conditions must be considered. If there is any uncertainty, consultation with a veterinarian is paramount. This systematic approach ensures that decisions are evidence-based, ethically sound, and legally compliant, prioritizing the health and welfare of the companion animals under their care. Question 8. Consider a scenario where a newly adopted cat is exhibiting persistent hiding behavior, refusing food and vocalizing distressfully at night, which has been ongoing for 3 days. As a companion animal attendant, what is the most appropriate initial course of action to address the cat's welfare concerns, adhering strictly to Australian animal welfare guidelines? Option A. Attempt to coax the cat out of hiding with treats and loud, cheerful encouragement to help it adjust more quickly. Option B. Advise the new owner to simply wait a few more days, as cats often take a long time to settle into a new environment, and this behavior is normal. Option C. Administer a small dose of a calming supplement that is commonly available at pet stores, based on anecdotal advice from other pet owners. Option D. Immediately consult with a veterinarian to rule out any underlying medical issues and seek professional advice on behavioral modification strategies. Correct answer is D. Immediately consult with a veterinarian to rule out any underlying medical issues and seek professional advice on behavioral modification strategies. Explanation. This scenario is professionally challenging because it requires the animal attendant to balance the immediate needs of a distressed animal with the long-term welfare and legal obligations concerning its care. The attendant must demonstrate a thorough understanding of companion animal behavior, welfare principles, and the relevant Australian legislative framework governing animal welfare, specifically the Prevention of Cruelty to Animals Act, or equivalent state/territory legislation. Careful judgment is required to interpret subtle behavioral cues and to select an intervention that is both effective and humane, avoiding any actions that could be construed as causing unnecessary suffering. The correct approach represents best professional practice because it prioritizes the animal's immediate welfare by seeking expert advice and implementing a plan based on established behavioral principles. This aligns with the duty of care mandated by animal welfare legislation, which requires individuals responsible for animals to take reasonable steps to alleviate suffering. Consulting a veterinarian or a qualified animal behaviorist ensures that the intervention is evidence-based, appropriate for the specific animal's condition, and adheres to ethical standards of animal care. This proactive and informed approach minimizes the risk of exacerbating the animal's distress or causing harm. An incorrect approach that involves immediately administering a sedative without veterinary consultation represents a significant regulatory and ethical failure. This bypasses the crucial diagnostic step of identifying the underlying cause of the distress, potentially masking a serious medical condition or a behavioral issue that requires specific training or environmental modification. Administering medication without professional guidance is a breach of animal welfare legislation, as it can lead to adverse drug reactions, inappropriate dosage, or the exacerbation of the animal's condition. It also demonstrates a lack of professional responsibility and a failure to adhere to best practice in animal care. Another incorrect approach, such as ignoring the behavior or assuming it will resolve on its own, is also a failure of professional duty. Animal welfare legislation typically imposes a positive obligation to act when an animal is suffering or showing signs of distress. Inaction in the face of observable distress can be interpreted as negligence and a failure to provide adequate care, potentially leading to prolonged suffering for the animal and legal repercussions for the attendant. This approach neglects the fundamental ethical responsibility to ensure the well-being of companion animals under one's care. The professional decision-making process for similar situations should involve a systematic approach. 1. Observation and assessment. Carefully observe the animal's behavior, noting specific signs of distress, their duration, and any potential triggers. 2. Information gathering. Consult the animal's history, owner's observations, and any available veterinary records. 3. Consultation. Seek advice from a veterinarian or a qualified animal behaviorist to diagnose the cause of distress and develop an appropriate management plan. 4. Intervention. Implement the recommended interventions, which may include environmental changes, training techniques, or medical treatment, ensuring they are humane and effective. 5. Monitoring and review. Continuously monitor the animal's response to interventions and adjust the plan as necessary in consultation with professionals. Question 9. The review process indicates that a client has requested a full groom for their anxious and matted terrier, specifying that they want the coat kept long. The animal exhibits signs of significant stress when handled, and the matting is so severe that it is causing discomfort and potential skin issues. The professional has assessed that a full groom with a long coat will be extremely difficult and potentially painful for the dog due to the matting and its anxious temperament. What is the most appropriate course of action for the professional? Option A. Perform a partial groom, addressing the most severe mats but leaving the rest of the coat long as requested, without fully explaining the potential long-term implications of the remaining matting. Option B. Proceed with the requested long coat groom, attempting to work through the mats carefully, and hope the dog tolerates it to satisfy the client's request. Option C. Inform the owner that the dog is too difficult to groom and refuse to provide the service, suggesting they seek veterinary attention for the matting. Option D. Discuss with the owner the necessity of a shorter clip to alleviate discomfort and reduce stress during grooming, explaining the risks associated with attempting to groom severely matted fur while maintaining a long coat, and propose a compromise that prioritizes the dog's welfare. The correct answer is D. Discuss with the owner the necessity of a shorter clip to alleviate discomfort and reduce stress during grooming, explaining the risks associated with attempting to groom severely matted fur while maintaining a long coat, and propose a compromise that prioritizes the dog's welfare. Explanation. This scenario presents a common implementation challenge in companion animal services, balancing client expectations with the animal's welfare and safety during grooming procedures. The professional must navigate potential owner dissatisfaction if the desired outcome isn't fully achievable due to the animal's condition or temperament, while adhering to best practices and relevant Australian regulations for animal care and handling. The challenge lies in communicating effectively with the owner about limitations and risks, ensuring the animal's comfort and safety throughout the process, and documenting the service provided. The correct approach prioritizes the animal's welfare and safety above all else, aligning with the principles of responsible animal care and the ethical obligations of a Certificate Roman III in companion animal services professional. This involves a thorough assessment of the animal, appropriate handling techniques, and clear communication with the owner. Specifically, it adheres to the principles of the Prevention of Cruelty to Animals Act (POCTA) in relevant Australian states, which mandates that animals must be treated humanely and not subjected to unnecessary pain or distress. It also reflects the industry standards and best practices expected of a qualified professional, ensuring a positive and safe experience for the animal. An incorrect approach that proceeds with a potentially harmful or stressful procedure without adequate assessment or owner consultation demonstrates a failure to uphold professional duty of care. This could lead to injury or distress for the animal, violating POCTA and potentially resulting in complaints or legal action. Another incorrect approach that prioritizes owner demands over the animal's immediate needs, such as forcing a difficult nail trim that causes significant fear or pain, is ethically unsound and breaches the expectation of humane treatment. Failing to communicate limitations or risks to the owner is a breach of professional transparency and can lead to misunderstandings and dissatisfaction, but the primary failure in this context is the disregard for the animal's welfare. Professional decision-making in such situations requires a systematic approach. 1. Assess the animal's physical condition, temperament, and any pre-existing health issues relevant to grooming. 2. Evaluate the owner's requests against the animal's needs and safety. 3. Communicate openly and honestly with the owner about what is achievable, potential risks, and alternative solutions. 4. Implement the grooming procedure using appropriate techniques and equipment, prioritizing the animal's comfort and safety. 5. Document the service provided, including any observations or discussions with the owner. Question 10. Which approach would be most appropriate for assessing the potential lifespan and health considerations for a newly acquired mixed-breed dog with an unknown history? Option A. Conducting a comprehensive risk assessment that considers species-specific predispositions, breed influences, where discernible, age estimation, current physical condition, and potential environmental impacts. Option B, prioritizing the most frequently reported health problems for dogs in general, without specific consideration for the individual animal's characteristics. Option C, relying on general knowledge of average dog lifespans and common health issues for mixed breeds, assuming a typical outcome. Option D, focusing solely on the dog's current outward appearance of good health and assuming no significant underlying issues will arise. The correct answer is A, conducting a comprehensive risk assessment that considers species-specific predispositions, breed influences where discernible, age estimation, current physical condition, and potential environmental impacts. Explanation: scenario analysis. This scenario is professionally challenging because it requires the assessment of an animal's health and lifespan, which are influenced by a complex interplay of genetics, environment, diet, and species-specific predispositions. Making an accurate assessment without proper investigation can lead to misinformed decisions regarding care, welfare, and potential reharming, impacting the animal's quality of life and potentially breaching duty of care obligations under relevant animal welfare legislation. Correct approach analysis. The correct approach involves a comprehensive risk assessment. This aligns with the principles of responsible animal care and management, which are fundamental to the Certificate Roman III in Companion Animal Services. A risk assessment systematically identifies potential health issues and lifespan limitations by considering the species, breed, age, current health status, and environmental factors. This proactive approach allows for the development of tailored care plans, early intervention strategies, and realistic expectations for the animal's future, thereby promoting optimal welfare and complying with legislative requirements to prevent suffering and ensure appropriate care. Incorrect approaches analysis. One incorrect approach is to rely solely on anecdotal evidence or general assumptions about a species' lifespan. This fails to account for individual variations and specific health concerns, potentially leading to inadequate care or premature euthanasia. Ethically, this is a failure to exercise due diligence and can breach the duty of care owed to the animal. Legally, it could contravene animal welfare laws that mandate providing appropriate care and preventing unnecessary suffering. Another incorrect approach is to focus only on the most common diseases for a species, without considering the individual animal's history or specific breed predispositions. This narrow focus might miss critical, less common but potentially serious health issues or lifespan-limiting conditions. It represents a failure to conduct a thorough assessment and could lead to a breach of professional standards and legislative obligations to provide comprehensive care. A third incorrect approach is to dismiss potential health concerns based on the animal's current apparent good health without further investigation. This overlooks the insidious nature of many chronic diseases and age-related conditions that may not be immediately visible. It is a failure to adopt a preventative and proactive approach to animal health, which is a cornerstone of responsible animal care and can lead to significant welfare compromises and potential breaches of animal welfare legislation. Professional reasoning. Professionals should adopt a systematic and evidence-based approach. This involves gathering information about the specific species and breed, obtaining a detailed history of the animal, conducting a thorough physical examination, and consulting relevant veterinary resources and professionals. A risk assessment framework allows for the identification of potential issues, the evaluation of their likelihood and impact, and the development of appropriate management strategies. This process ensures that decisions are made in the best interests of the animal's welfare and in compliance with all relevant legislation and ethical guidelines. Question 11. Market research demonstrates that clients often seek advice on managing common behavioral issues in their pets. A client reports their dog, a typically friendly Labrador, has recently started growling when approached while eating. Which of the following approaches best reflects an understanding of common companion animal behavioral characteristics and best practice for providing advice? Option A. Suggest the client observe the dog's body language closely, consider if there have been any recent changes in the household or routine, and research common canine behaviors related to resource guarding. Option B. Recommend the client punish the dog with a sharp reprimand whenever it growls during feeding to discourage the behavior. Option C. Advise the client that the dog is being possessive and recommend immediately taking the food away to assert dominance. Option D. Inform the client that this behavior is unusual for Labradors, and they should simply avoid approaching the dog during mealtimes without further investigation. The correct answer is C. Advise the client that the dog is being possessive and recommend immediately taking the food away to assert dominance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an individual to interpret and apply knowledge of common companion animal behavioral characteristics in a practical, client-facing context. The challenge lies in moving beyond theoretical understanding to making informed recommendations that are safe, ethical, and beneficial for both the animal and the owner, while also adhering to the principles of responsible pet ownership as outlined in relevant Australian companion animal regulations and industry best practices. Misinterpreting behavioral cues or making inappropriate recommendations can lead to animal welfare issues, owner dissatisfaction, and potential breaches of duty of care. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a holistic understanding of the animal's behavior within its species-specific context and individual history. It involves observing the animal's body language, considering its environment, and understanding common breed-specific predispositions to certain behaviors. This aligns with the ethical obligations under Australian animal welfare legislation, which mandates that individuals involved in companion animal services must take reasonable steps to ensure the welfare of animals under their care. Furthermore, it reflects the principles of the Certificate Roman III in companion animal services, which emphasizes evidence-based approaches to animal behavior and management. By considering the underlying motivations for behavior, e.g., fear, anxiety, territoriality, professionals can offer tailored advice that addresses the root cause, promoting positive outcomes and responsible pet ownership. Incorrect approaches analysis. One incorrect approach fails by oversimplifying behavior to a single, potentially anthropomorphic interpretation, such as attributing malice to an animal's actions. This ignores the complex interplay of instinct, environment, and learning that shapes animal behavior and can lead to inappropriate management strategies that may exacerbate the problem or cause distress to the animal, potentially contravening the duty of care under animal welfare legislation. Another incorrect approach is to solely rely on anecdotal evidence or popular myths about animal behavior without critical evaluation. This can perpetuate misinformation and lead to ineffective or harmful advice, failing to meet the professional standards expected in companion animal services, and potentially contravening guidelines that promote evidence-based practice. A further incorrect approach involves recommending immediate punitive measures without understanding the behavioral context. Such actions can be detrimental to the animal's welfare, erode the human-animal bond, and may be considered a failure to provide appropriate care and management, potentially breaching animal welfare principles. Professional reasoning. Professionals in companion animal services should adopt a systematic decision-making process. This involves 1. Active observation and data gathering, behavioral cues, environment, history. 2. Applying knowledge of species-specific and breed-specific behavioral characteristics. 3. Considering potential underlying causes for the behavior, e.g., fear, stress, unmet needs. 4. Consulting relevant Australian regulatory frameworks and industry best practices for guidance on animal welfare and responsible pet ownership. 5. Developing and recommending management strategies that are humane, effective, and tailored to the individual animal and owner circumstances. 6. Continuously evaluating the effectiveness of interventions and adapting as necessary. Question 12. Operational review demonstrates that a client has expressed concern about their dog's lethargy and has suggested a change to a high-energy, commercial dog food to address it. The dog is currently on a standard adult maintenance diet. What is the most appropriate risk assessment approach to ensure the animal's health and welfare? Option A. Suggest the client increase the dog's exercise regime significantly to combat lethargy, without addressing the dietary concern. Option B. Immediately recommend the high-energy, commercial dog food to the client, as it is a readily available solution for perceived low energy. Option C. Advise the client to consult a veterinarian to diagnose the cause of the lethargy and discuss appropriate dietary adjustments based on veterinary findings. Option D. Recommend adding a general-purpose vitamin and mineral supplement to the dog's current diet to boost energy levels. The correct answer is C. Advise the client to consult a veterinarian to diagnose the cause of the lethargy and discuss appropriate dietary adjustments based on veterinary findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal care professional to balance immediate client requests with the long-term health and welfare of the animal, adhering to Australian regulatory standards for companion animal services. The risk of misinterpreting or inadequately addressing a potential health issue, especially one related to nutrition, can have significant consequences for the animal's well-being and the professional's reputation and legal standing. The pressure to provide a quick solution without proper assessment necessitates careful judgment. Correct approach analysis. The correct approach involves a thorough risk assessment that prioritizes the animal's health by consulting with a veterinarian. This aligns with the principles of responsible animal care and the implicit duty of care under Australian consumer law and animal welfare legislation. The Certificate Roman III in Companion Animal Services curriculum emphasizes recognizing signs of ill health and knowing when to seek professional veterinary advice. This approach ensures that any nutritional recommendations are evidence-based, safe, and appropriate for the specific animal's condition, preventing potential harm and fulfilling the professional's ethical and legal obligations. Incorrect approaches analysis. One incorrect approach involves immediately implementing a drastic diet change based solely on the owner's observation of lethargy. This bypasses essential veterinary diagnostics, potentially masking a more serious underlying health issue or causing nutritional imbalances. This failure to seek professional veterinary advice constitutes a breach of the duty of care and could contravene animal welfare standards by not ensuring the animal receives appropriate care for its health needs. Another incorrect approach is to dismiss the owner's concerns and continue with the current feeding regime without further investigation. This demonstrates a lack of diligence and a failure to adequately assess potential risks to the animal's health. It neglects the professional's responsibility to observe and report changes in animal behavior or condition, potentially leading to delayed diagnosis and treatment of a health problem, which is ethically and legally unacceptable. A third incorrect approach is to recommend over-the-counter supplements without understanding the cause of the lethargy or the animal's specific dietary needs. This is a form of unqualified advice that could lead to adverse reactions, nutrient toxicities, or interactions with existing conditions. It represents a failure to adhere to best practice guidelines for animal health and nutrition advice, which mandates professional consultation for such matters. Professional reasoning. Professionals in companion animal services should adopt a systematic risk assessment process. This begins with active listening to the client's concerns, followed by a thorough observation of the animal's general condition and behavior. If any signs suggest a potential health issue, particularly one that could be linked to diet or nutrition, the immediate next step should be to advise the client to consult a veterinarian. This ensures that any diagnosis and treatment plan are established by a qualified professional. Documenting all observations and advice given is also crucial for professional accountability. Question 13. The investigation demonstrates that a customer is seeking advice on purchasing an over-the-counter flea and tick treatment for their dog, which has a noticeable infestation. The customer mentions that they have tried a few different OTC products previously with limited success and are looking for something more potent. Considering the regulatory framework for companion animal services in Australia, which of the following actions best reflects compliance and professional best practice? Option A. Recommend a specific OTC flea and tick treatment that is legally available for direct sale, and strongly advise the customer to consult a veterinarian for a proper diagnosis and discussion of prescription strength options, especially given their previous limited success with OTC products. Option B. Advise the customer to purchase a well-regarded, readily available OTC flea and tick treatment from the store, suggesting they follow the product instructions carefully and return if the problem persists. Option C. Recommend a specific prescription strength flea and tick treatment that is known to be highly effective, explaining that while it requires a prescription, it is the most potent option available. Option D. Suggest a range of natural or homemade remedies that are often discussed online for flea and tick control, as these are generally safe and can be used alongside other treatments. The correct answer is C. Recommend a specific prescription-strength flea and tick treatment that is known to be highly effective, explaining that while it requires a prescription, it is the most potent option available. Explanation. This scenario presents a professional challenge because it requires the application of specific Australian regulatory requirements for companion animal parasite control, specifically concerning the sale of over-the-counter OTC, flea and tick treatments. The challenge lies in ensuring that advice provided to a customer aligns with the legal framework governing the sale of these products, which often distinguishes between products requiring veterinary oversight and those that can be sold directly. Misinterpreting these regulations can lead to providing incorrect advice, potentially compromising animal health, and contravening consumer protection laws. The correct approach represents best professional practice because it adheres strictly to the Australian regulatory framework for companion animal services and the sale of veterinary medicines. By recommending products that are legally available for direct sale and advising the customer to consult a veterinarian for prescription-strength treatments, or if the animal's condition is severe, the professional is acting within their scope of practice and complying with relevant legislation. This ensures animal welfare by promoting appropriate treatment and prevents the illegal sale or dispensing of restricted veterinary medicines. It also upholds consumer trust by providing accurate and legally sound advice. An incorrect approach that involves recommending a prescription-only flea and tick treatment without a veterinary consultation represents a significant regulatory and ethical failure. This contravenes Australian veterinary medicine regulations, which classify certain parasiticides as prescription-only, requiring a veterinarian's assessment and prescription. Providing such a product directly to a customer without this oversight is illegal and can lead to inappropriate use, potential adverse reactions in the animal, and a failure to address underlying health issues that might be contributing to the parasite infestation. Another incorrect approach, such as suggesting a homemade or unproven natural remedy as a primary treatment for a severe flea and tick infestation, is also professionally unacceptable. While natural remedies may have a place in some contexts, relying on them solely for significant infestations without evidence of efficacy or safety, and without advising on regulated, proven treatments, can lead to prolonged suffering for the animal and a worsening of the infestation. This fails to meet the duty of care owed to the companion animal and the owner, and may breach consumer protection guidelines regarding the sale of pet products. A professional decision-making process for similar situations should involve 1. Identifying the specific product type and its regulatory classification, OTC vs. prescription only. 2. Understanding the scope of practice for the role within the companion animal services industry. 3. Consulting relevant Australian legislation and guidelines pertaining to the sale and advice on veterinary medicines. 4. Prioritizing animal welfare by recommending appropriate, safe, and legally available treatments. 5. Clearly communicating limitations of advice and the necessity of veterinary consultation for prescription products or complex health issues. Question 14. The monitoring system demonstrates a dog becoming increasingly agitated and vocal during a routine nail trim at the grooming salon. Despite initial gentle handling and positive reinforcement, the dog is now attempting to pull away forcefully, showing signs of fear such as panting and lip licking. The groomer needs to complete the nail trim to prevent discomfort for the dog. Option A. Attempt to distract the dog with a high-value treat while continuing the nail trim, and if the dog remains resistant, stop and consult with the owner about alternative solutions. Option B. Immediately cease the nail trim and return the dog to its owner, advising them to seek veterinary assistance for future grooming. Option C. Gently but firmly hold the dog in place using a standard grooming loop, continuing the nail trim while speaking in a calm, reassuring voice. Option D. Apply a muzzle for safety and secure the dog more tightly with the grooming loop to ensure the nail trim can be completed quickly. The correct answer is C. Gently but firmly hold the dog in place using a standard grooming loop, continuing the nail trim while speaking in a calm, reassuring voice. Explanation. This scenario presents a common ethical dilemma in companion animal services, specifically concerning the balance between animal welfare and necessary handling for veterinary procedures. The challenge lies in determining the most appropriate restraint method when an animal exhibits fear and resistance, ensuring safety for both the animal and the handler while adhering to professional standards and legal obligations. The core tension is between achieving the veterinary objective and minimizing stress and potential harm to the animal. The correct approach prioritizes the animal's well-being and safety, employing the least stressful and least restrictive method, that still allows for the necessary veterinary examination or grooming. This aligns with the principles of responsible animal care, which are often codified in industry guidelines and, in Australia, by state-level animal welfare legislation and codes of practice. Best professional practice dictates a graduated approach to restraint, starting with gentle handling and positive reinforcement, and only escalating to more secure methods if absolutely necessary and performed by trained personnel. This minimizes the risk of injury to the animal, e.g., fractures, sprains, abrasions, and the handler, and reduces the animal's fear and anxiety, which can have long-term behavioral implications. An incorrect approach would involve using excessive force or a method that is inherently stressful or dangerous for the animal without sufficient justification. For instance, forcing a highly distressed animal into a position that causes significant pain or fear, or using a restraint that could lead to injury, would be a failure to uphold duty of care. This could contravene the Prevention of Cruelty to Animals Act or equivalent state legislation by causing unnecessary suffering. Furthermore, failing to adequately assess the animal's stress signals and adapt the restraint method accordingly demonstrates a lack of professional competence and ethical consideration. Relying solely on a single, forceful method without attempting to de-escalate or find alternatives ignores the animal's individual needs and emotional state. Professional decision-making in such situations requires a thorough assessment of the animal's temperament, the specific procedure being performed, and the available resources. It involves a risk-benefit analysis, weighing the necessity of the procedure against the potential stress and harm to the animal. Professionals should be trained in recognizing and responding to animal stress signals and possess a repertoire of restraint techniques, including low-stress handling methods. When in doubt, seeking assistance from a more experienced colleague or a veterinarian is a sign of professional maturity and commitment to animal welfare. The ultimate goal is to achieve the necessary outcome with the least amount of distress and risk to the animal. Question 15. Performance analysis shows that a newly adopted terrier mix is exhibiting signs of anxiety and resistance when being placed into a kennel. The handler needs to secure the dog safely and calmly. Which of the following approaches best demonstrates adherence to Australian Companion Animal Service handling principles? Option A. Firmly grasp the dog's collar and pull it directly into the kennel, using a stern voice to assert dominance. Option B. Gently guide the dog into the kennel using a calm voice and a loose lead, allowing it to explore the space briefly before closing the door. Option C. Wait for the dog to calm down completely on its own before attempting any interaction, even if it means leaving the dog outside the kennel for an extended period. Option D. Immediately apply a muzzle and then forcefully push the dog into the kennel to prevent any potential biting. The correct answer is B. Gently guide the dog into the kennel using a calm voice and a loose lead, allowing it to explore the space briefly before closing the door. Explanation: this scenario is professionally challenging because it requires the handler to balance the immediate need for control with the animal's welfare and safety, all within the confines of Australian Companion Animal Service regulations. The handler must make a rapid assessment of the dog's stress signals and choose a restraint method that is effective without causing undue harm or distress, adhering to the principles of humane treatment and animal welfare legislation applicable in Australia. The correct approach represents best professional practice because it prioritizes the animal's well-being by employing a technique that is minimally invasive and responsive to the animal's behavior. This aligns with the Australian animal welfare standards and guidelines, which mandate that animals are handled in a way that minimizes pain, suffering, and distress. Using a gentle but firm grip, combined with calm verbal cues, demonstrates an understanding of canine body language and a commitment to de-escalation, which is a cornerstone of responsible animal handling in a professional setting. An incorrect approach involving forceful or aggressive physical manipulation would fail to meet regulatory requirements. Such actions could be interpreted as animal cruelty or neglect under Australian state and territory animal welfare acts, leading to potential penalties. Furthermore, it breaches ethical guidelines for animal care professionals, which emphasize empathy and a non-aversive approach. Using a restraint method that is overly restrictive or causes pain, without sufficient justification or consideration for alternatives, demonstrates a lack of competence and disregard for the animal's welfare. This could also lead to the animal developing fear or aggression towards handlers, impacting future interactions and the overall effectiveness of animal services. Professionals should employ a decision-making framework that begins with observing and interpreting the animal's behavior and stress signals. This assessment should then inform the selection of the most appropriate and least stressful restraint technique. If a technique is proving ineffective or causing distress, the professional should immediately reassess and consider alternative methods or seek assistance. Continuous learning and adherence to current best practices and regulatory requirements are essential for maintaining professional standards. Question 16. The audit findings indicate a recurring issue with the cleanliness of animal enclosures and shared equipment, raising concerns about potential disease transmission within the facility. Which of the following actions best addresses this situation in accordance with Australian regulatory frameworks for companion animal services? Option A. Conduct a superficial clean of all enclosures and equipment before the next scheduled inspection to give the appearance of compliance. Option B. Issue formal warnings to all staff members involved in enclosure cleaning, citing their individual responsibility for the hygiene lapses. Option C. Immediately implement a mandatory, facility-wide retraining program on hygiene protocols, including practical demonstrations, and review and update the cleaning schedule and supply inventory to ensure adequate resources are available. Option D. Advise management that the audit findings are likely due to minor oversights and that no immediate action is necessary, as the animals appear healthy. Correct answer is C. Immediately implement a mandatory, facility-wide retraining program on hygiene protocols, including practical demonstrations, and review and update the cleaning schedule and supply inventory to ensure adequate resources are available. Explanation. The audit findings indicate a potential lapse in hygiene practices within a companion animal service facility. This scenario is professionally challenging because maintaining rigorous hygiene is fundamental to preventing the spread of zoonotic diseases and ensuring the welfare of both animals and staff. A failure in this area can have significant health consequences, reputational damage, and legal ramifications. Careful judgment is required to identify the most effective and compliant response to the audit findings. The correct approach represents best professional practice because it directly addresses the identified hygiene deficiency by implementing a comprehensive review and update of existing protocols. This aligns with the principles of responsible animal care and the legal obligations under Australian animal welfare legislation and workplace health and safety regulations. Proactive measures such as staff training and the procurement of appropriate cleaning supplies demonstrate a commitment to preventing future outbreaks and ensuring a safe environment, thereby upholding the duty of care owed to the animals and clients. An incorrect approach that focuses solely on superficial cleaning without addressing the underlying systemic issues is professionally unacceptable. This fails to meet the standards expected under Australian regulations that mandate effective disease prevention strategies. It also represents an ethical failure as it prioritizes a quick fix over a sustainable solution, potentially leaving the facility vulnerable to recurring hygiene problems and disease transmission. Another incorrect approach that involves blaming individual staff members without a thorough investigation into the adequacy of training and resources is also professionally unacceptable. This approach neglects the employer's responsibility to provide a safe working environment and adequate training, which are key requirements under Australian workplace health and safety laws. It also fails to address the root cause of the hygiene lapse, which may stem from systemic issues rather than individual negligence. A further incorrect approach that involves ignoring the audit findings and hoping the issue resolves itself is the most egregious failure. This demonstrates a complete disregard for regulatory compliance and ethical responsibility. It exposes the facility to significant risks, including disease outbreaks, legal penalties, and loss of public trust, all of which are contrary to the objectives of the Certificate Roman III in companion animal services. Professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the audit findings and their implications. Second, consulting relevant Australian legislation and industry guidelines pertaining to animal hygiene and workplace safety. Third, evaluating the current protocols and identifying specific gaps. Fourth, developing and implementing a corrective action plan that includes training, resource allocation, and protocol updates. And finally, establishing a system for ongoing monitoring and evaluation to ensure sustained compliance and best practice. Question 17. Governance review demonstrates that a companion animal services professional is handling a newly acquired dog for a grooming appointment. The dog is exhibiting subtle signs of stress, including lip licking and a slightly tucked tail, but is not overtly aggressive. Which approach best minimizes stress during handling while adhering to regulatory expectations for companion animal welfare? Option A. Continue with the planned grooming routine as the dog is not showing extreme distress, assuming it will eventually settle down. Option B. Gently restrain the dog firmly and proceed with the grooming, as a degree of stress is unavoidable during such procedures. Option C. Immediately cease grooming, calmly move the dog to a quiet, separate area, and allow it time to relax before reintroducing handling in short, positive sessions. Option D. Increase the speed and force of handling to complete the grooming quickly, thereby reducing the duration of the stressful experience. The correct answer is A. Continue with the planned grooming routine as the dog is not showing extreme distress, assuming it will eventually settle down. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the application of knowledge about animal behavior and welfare within a practical handling situation. Misinterpreting an animal's stress signals can lead to fear, anxiety, injury to both the animal and the handler, damage to the human-animal bond. The challenge lies in accurately identifying subtle signs of stress and implementing appropriate evidence-based interventions that align with the principles of humane animal handling and the regulatory requirements for companion animal services. Correct approach analysis. The correct approach involves a proactive and observant strategy. This means understanding common stress indicators in companion animals, such as panting, lip licking, yawning, tail tucking vocalizations, or attempts to escape. It also requires the handler to modify their own behavior and the environment to reduce these stressors. This might include using a calm and quiet tone of voice, moving slowly and predictably, providing positive reinforcement, and ensuring the handling environment is safe and familiar. This approach is best professional practice as it directly addresses the animal's welfare, minimizes potential harm, and is consistent with the ethical obligations of a Certificate Roman III in companion animal services, professional to provide humane care and handling. It aligns with the general principles of animal welfare legislation that mandate the prevention of unnecessary pain, suffering, and distress. Incorrect approaches analysis. One incorrect approach involves ignoring or dismissing subtle signs of stress, assuming the animal is simply being difficult or resistant. This is a regulatory and ethical failure because it breaches the duty of care to prevent unnecessary distress. It demonstrates a lack of understanding of animal behavior and a disregard for the animal's well-being, which is contrary to the core competencies expected of a companion animal services professional. Another incorrect approach is to use forceful or punitive methods to overcome the animal's resistance, such as shouting, pulling, or restraining aggressively. This is a significant regulatory and ethical failure. Such methods can escalate stress, cause physical injury, and create lasting fear and negative associations with handling. It directly contravenes the principles of humane treatment and can lead to breaches of animal welfare legislation that prohibit cruelty and the infliction of suffering. A third incorrect approach is to rely solely on the animal's breed or species as a predictor of stress response, without observing the individual animal's current behavior. While general species-specific behaviors are informative, individual animals can react differently based on past experiences, personality, and the immediate context. This approach is ethically problematic as it can lead to misjudgments and inappropriate handling, potentially causing stress to an animal that is not exhibiting typical breed-related stress signals. It fails to uphold the professional standard of individualized care and assessment. Professional reasoning. Professionals should adopt a systematic approach to handling. This involves 1. Pre-handling assessment, observing the animal's body language and behavior before and during initial contact. 2. Environmental assessment, ensuring the handling space is calm, safe, and free from excessive noise or distractions. 3. Gradual introduction, approaching the animal calmly and allowing it to acclimatize. 4. Behavioral interpretation, actively looking for and interpreting signs of stress. 5. Adaptive handling, modifying handling techniques, pace, and pressure based on the animal's responses. 6. Positive reinforcement, using rewards to create positive associations with handling. 7. Seeking assistance. If stress levels are high or unmanageable, consulting with a supervisor or experienced professional. This decision-making process prioritizes the animal's welfare, and ensures compliance with professional standards and ethical obligations. Question 18. Benchmark analysis indicates that a newly admitted dog to a shelter is exhibiting tense body posture, a tucked tail, lip licking, and yawning when approached by an attendant. The dog is also avoiding eye contact and has its ears pinned back. What is the most appropriate initial course of action for the attendant to take, adhering to Australian animal welfare principles? Option A. Proceed with the standard intake procedures, including weighing and measuring the dog, as quickly as possible. Option B. Place the dog in a small, secure kennel and leave it alone for an extended period to calm down. Option C. Provide the dog with a quiet, low-stimulus space and observe from a distance, allowing the dog to approach when it feels comfortable. Option D. Immediately attempt to comfort the dog by offering treats and gentle petting to build trust. The correct answer is C. Provide the dog with a quiet, low-stimulus space and observe from a distance, allowing the dog to approach when it feels comfortable. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal attendant to interpret subtle behavioral cues in a dog exhibiting signs of stress and fear, and to respond in a way that prioritizes the animal's welfare, while also managing potential risks to themselves and others. Misinterpreting these signals could lead to an escalation of the dog's distress, potential injury to the animal or human, and a failure to meet the duty of care expected under Australian animal welfare legislation. The attendant must balance the need for assessment with the immediate requirement to de-escalate the situation. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the animal's immediate comfort and safety. By providing a quiet, low-stimulus environment and avoiding direct interaction until the dog shows signs of relaxation, the attendant is applying principles of positive reinforcement and stress reduction. This aligns with the ethical obligations under the Prevention of Cruelty to Animals Act 1979, NSW, and the general principles of animal welfare, which mandate that animals must be provided with an environment that meets their behavioral needs and protected from unnecessary suffering. This approach respects the animal's autonomy and allows it to self-regulate. Incorrect approaches analysis. One incorrect approach involves immediately attempting to handle the dog, perhaps by offering treats or trying to pet it. This fails to recognize the dog's current state of fear and stress. Forcing interaction can be perceived as a threat by a fearful animal, potentially leading to defensive aggression, further increasing the dog's distress and creating a dangerous situation. This approach breaches the duty of care to prevent harm and could be seen as causing unnecessary suffering under animal welfare legislation. Another incorrect approach is to ignore the dog's behavior and proceed with routine tasks as if nothing is wrong. This demonstrates a lack of observational skill and a failure to respond to an animal in distress. It neglects the fundamental responsibility to monitor animal welfare and intervene appropriately when signs of suffering are present. This inaction could be interpreted as negligence and a failure to uphold the standards of care required by the Certificate Roman III in Companion Animal Services Training and associated industry guidelines. A further incorrect approach might be to isolate the dog in a confined space without any attempt at de-escalation or assessment of its needs. While isolation can sometimes be a temporary measure, doing so without understanding the cause of the distress or providing any comfort can exacerbate fear and anxiety. This can lead to learned helplessness or increased behavioral problems, and is not a proactive or welfare-focused response. Professional reasoning. Professionals should employ a systematic approach to animal behavior assessment. This involves 1. Observation, carefully observing the animal's body language and behavior in its current environment. 2. Environmental assessment, identifying potential stressors in the environment. 3. De-escalation, implementing strategies to reduce stress and fear, prioritizing the animal's comfort and safety. 4. Gradual interaction, only engaging with the animal once it shows signs of relaxation and willingness to interact. 5. Documentation, recording observations and interventions for future reference and to inform ongoing care. This process ensures that decisions are evidence-based, ethical, and prioritize the animal's welfare in accordance with legislative requirements. Question 19. Implementation of appropriate restraint equipment for a nervous dog during a veterinary examination requires careful consideration of the animal's welfare. Which of the following approaches best reflects professional best practice and regulatory compliance in Australia? Option A. Using a muzzle that is so tight it prevents the dog from breathing through its mouth and leaving it on for an extended period without checking for signs of distress. Option B. Placing the dog in a carrier that is clearly too small for it to stand or turn around in and leaving the door closed without supervision. Option C. Securing the dog with a choke chain that is tightened significantly to prevent any pulling or lunging and leaving it on for the entire duration of the examination. Option D. Using a well-fitted adjustable harness and a standard lead, ensuring the dog can pant comfortably and is not unduly restricted, while providing reassurance and positive reinforcement. The correct answer is D. Using a well-fitted adjustable harness and a standard lead, ensuring the dog can pant comfortably and is not unduly restricted, while providing reassurance and positive reinforcement. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for control and safety with the animal's welfare and stress levels. The correct use of equipment like leashes, muzzles, and carriers is not just about restraint, but also about minimizing fear and anxiety, adhering to animal welfare principles, and complying with relevant Australian legislation, such as the Prevention of Cruelty to Animals Act (POCTA) in various states, and potentially local council bylaws regarding animal control. The correct approach involves selecting and using equipment that is appropriate for the individual animal's size, temperament, and the specific situation, ensuring it is fitted correctly to prevent injury or undue discomfort. This demonstrates best professional practice by prioritizing the animal's physical and psychological well-being, which is a core ethical and legal obligation. It also ensures the equipment serves its intended purpose effectively and safely, reducing the risk of escape or aggression. An incorrect approach of using a leash that is too short or too tight can cause physical pain and distress, potentially leading to a negative association with handling and increasing anxiety. This could be considered a breach of animal welfare legislation by causing unnecessary suffering. Using a muzzle that is ill-fitting or left on for extended periods without breaks can impede the animal's ability to pant, drink, or become distressed, also contravening welfare standards. Similarly, forcing an animal into a carrier that is too small or unsuitable for its needs can cause significant stress and fear, potentially leading to injury and a failure to meet duty of care obligations. Professionals should employ a decision-making process that begins with assessing the individual animal's needs and the context of the situation. This involves considering the animal's species, breed, age, temperament, and any known behavioral issues. The choice of equipment should then be made based on this assessment, prioritizing safety and welfare. Training and acclimatization to equipment should be considered where possible. If restraint is necessary, the least restrictive method that achieves the required safety should be chosen, and the animal's response should be continuously monitored. Regular review of equipment and techniques ensures ongoing compliance with best practices and legal requirements. Question 20. Risk assessment procedures indicate that a client's long-haired cat, usually well-groomed, has recently developed a noticeable matting of fur around its hindquarters, which the owner states is due to the cat's age and reluctance to be groomed. The owner expresses concern about the cost of regular veterinary checkups and believes the cat is otherwise healthy. You are aware that severe matting can lead to skin irritation, infections, and discomfort, and that regular veterinary checkups are crucial for early detection of age-related health issues. What is the most appropriate course of action? Option A. Inform the owner that you cannot provide care for the cat due to the matting and advise them to seek veterinary attention immediately without offering further assistance or information. Option B. Attempt to groom the cat yourself to remove the matting without consulting a veterinarian and advise the owner that this should resolve the issue. Option C. Advise the owner on safe at-home grooming techniques for mild matting. Explain the potential health risks associated with severe matting and the importance of veterinary assessment for underlying causes and appropriate treatment, and offer to help the owner find a veterinary clinic that offers payment plans. Option D. Agree with the owner that the matting is likely due to age and that regular veterinary checkups are not essential if the cat appears otherwise well, focusing instead on basic hygiene advice. The correct answer is C. Advise the owner on safe at-home grooming techniques for mild matting. Explain the potential health risks associated with severe matting and the importance of veterinary assessment for underlying causes and appropriate treatment, and offer to help the owner find a veterinary clinic that offers payment plans. Explanation. This scenario presents a professional challenge because it requires balancing the owner's stated wishes with the animal's welfare, a core ethical and regulatory obligation for those working with companion animals. The challenge lies in navigating potential owner resistance to preventative care recommendations while upholding the duty of care towards the animal. Careful judgment is required to communicate effectively and ethically. The correct approach represents best professional practice because it prioritizes the animal's health and well-being, aligning with the principles of responsible animal care and the legislative framework governing companion animal services. It involves open communication with the owner, providing clear, evidence-based information about the benefits of preventative health care and regular veterinary checkups, and offering support to facilitate these actions. This approach respects the owner's role while ensuring the animal receives appropriate care, thereby fulfilling the professional's duty of care as outlined in industry standards and potentially relevant animal welfare legislation. An incorrect approach that involves dismissing the owner's concerns or proceeding with care without their informed consent would represent a significant regulatory and ethical failure. Dismissing concerns undermines the owner's autonomy and can lead to a breakdown in the professional-owner relationship, potentially resulting in the animal not receiving necessary care. Proceeding without consent could be seen as a breach of trust and potentially a violation of animal welfare principles that require owner cooperation for ongoing care. Another incorrect approach, such as simply agreeing with the owner's reluctance without offering alternatives or further education, fails to uphold the professional's responsibility to advocate for the animal's health and could lead to preventable suffering or illness. This inaction neglects the proactive role expected in preventative health care. Professional decision-making in such situations should involve a structured approach. First, actively listen to and acknowledge the owner's concerns. Second, provide clear, concise, and accurate information regarding the importance of preventative health care and regular veterinary visits, explaining the potential risks of neglecting these. Third, explore the reasons behind the owner's reluctance, e.g., cost, perceived lack of need, fear, and offer solutions or resources where possible, e.g., discussing payment plans with the vet, providing educational materials. Fourth, document all discussions and recommendations. Finally, if there is a genuine risk to the animal's welfare due to the owner's refusal of essential preventative care, the professional must consider their reporting obligations under relevant animal welfare legislation.